pragmatic approach of thyroid disorders according to Ayurveda. I think thyroid disorder might be much higher in places away from the Ganges, especially the northeast aspect, as well as it may be much more higher in your areas too, because I can imagine that the absence of or availability of iodine may be bit less through the food in a normal day-to-day life. Maybe because of that reasons, one of the reason may be that thyroid disorders has been challenged by the people from higher altitude. People are living from higher zones, and that may be one of the reason why the universal iodization started. As you know, in 1981, when the World Health Organization began a national level, global level program called Universal Iodization Program, which become a key thing for even for the political purposes in many part of the country, in India, probably to the Nepal too. But over a period of time, this presence of extra iodine in the mainstream system left a large problem which was not really identified, neither observed by the scientist, nor even a detailed study has conducted to check the competency of this universal iodization or to modify the existing system by and large. So, in that perspective, this presence of high iodine might have created a lot of problem, and nowadays we strongly believe that there is a good number of people also having thyroid dysfunction, especially hypothyroidism, due to this usage of this iodine. Anyhow, from a medical point of view, as you know very well that thyroid disorders are the most common disorders in the endocrine system, that may be affecting nearly 40 to 50 million people, at least even in India. So I can imagine what will happen in many other countries too. A general statistic says that women are 6 times more prone than men, and most of the women, especially between the age of 40 plus, often have many of the symptoms of hypothyroidism, which oftenly recognized as subclinical hypothyroidism in general. But from a medical point of view, treating thyroid dysfunction in the male is more challenging, even though they are the minority community. And even many researchers shows that the malignancies of the thyroid gland is increasing alarmingly, and moreover it is more common in male. So today in a short way I would like to speak about thyroid dysfunction and most commonly about hypothyroidism. So in general, I can say almost every 1 in 10 people have getting thyroid dysfunction, and most of the time they are very unfortunate to find any medical solution, and they end up with the different difficulties. As you know well, nowadays due to the social media as well as the Google or whatever the information transformations and information junk, large number of people either by a direct prescription from a doctor or by self suspicion go to a lab and check the status of thyroid dysfunction. So once they find their TSH level is slightly higher, maybe, which is supposed to fall between 0.5 to 5, 0.5 to 5 or 0.6 to 6, depends upon the different scale what we take in different associations, like whether it's an endocrinology association of UK or American endocrine association, whatever. Normally these people who have this thyroid dysfunction, when they find the TSH level goes up, what they do is that they try to consult a doctor, preferably an endocrinologist, and because of that, doctor may start with a small prescription like a thyroxine or levothyroxine, called as a levothyroxine, under the brand maybe Thyronorm, whatever. Many times there are two categories of people maybe there. One category of people, those who have symptoms, they have really some problem, some symptoms, and another category of people, those doesn't have any symptom. And irrespective of these, whether we have symptom or no symptoms, the conventional medical clinician will say, let us start the thyroxine, maybe 25 milligram, 50 milligram, depends upon his assumptions about the condition. And because of that, he will start with this hormone tablet. And the challenge happens in the next is that since there is no symptom, or they have a mild symptom, when they start taking this medication, when they ask the doctor what I should do when I have to take this medicine, so doctor will say you have to take in the morning time, and the doctor will ask the patient, okay, how long I should take, so they will have an answer to that, you have to take lifelong. This is bitty scare for the people, a medication that should be taken lifelong. So they normally turn to another alternative options like Ayurveda or homeopathy or some folk practices, and they come to a medical attention of Ayurvedic community for multiple reasons. So once they will ask is, do Ayurveda have any understanding of this disease? If so, can you help us to withdraw these medicines which I am already taking, maybe 6 months, 1 year, up to 10 years, people may come. And second thing, that do you have some medications initially to combine with these medicines so that I maybe get out of symptoms too. Very unfortunately, as we all know as a clinician, that even after taking this thyroxine, many people doesn't feel comfortable. They have the same symptoms before too. So they are really fed up with what they are taking, and they are really looking for an alternative choice, and they call out for help, do any other medicine. So this is the background by which normally we have the people for the thyroid dysfunction. So since it is a long lasting treatment or long lasting things to be done, often people will look for alternative, and they will ask what Ayurvedic people want to say about this. So we have to explain the people what is this, what we are trying to do, and what help we can do with this. Nowadays, very simple way we can explain people that thyroid is just like a battery of your mobile, because this is the gadget you carry upon whole day, so you know what is the importance of a battery. So you can say that the people, okay, battery is something which helps to run your WhatsApp, on your Facebook, or whatever, the gaming, whatever. Exactly the same thing, thyroid also is very essential, because it controls the basic metabolic rate, it controls the or promotes the glucose catabolism for the energy, lipid metabolism, It also helps for keeping the appetite good, protein synthesis. Thyroid hormone is really extended almost every nook and corner of the body. Maybe starting from the hypothalamus, which has a hormone called thyroid releasing hormone, for which it stimulates the from pituitary there is a thyroid releasing hormone. From that hypothalamus then goes to the thyroid stimulating hormone, then comes the thyroid gland, as we know that triiodothyroxine, tetroidothyroxines, and it go to the bloodstream, and this is the thing, very simple. So we have two hormones essentially travel in the bloodstream, and in this bloodstream when it travels it reaches to the target cells wherever it needs, and it utilizes most by a large T4 will be available, and but when it loses one iodine, so it becomes T3, which is more useful to useful for the application or the consumption of real energy in the system. So that this is how it does things. So if we understand the same thing from Ayurveda, so we can think that there is a pranavata which really have a connection with all other vata. So there is a connection from a pranavata to udhanavada, vak pravarti prayatna urja bala varna smriti kriya. So then it from udhana to vyanavada, the whole body, it diffuses to the whole body. So vyano hridisthidha, all the cardiac activity is related with that due to the thyroid. Gatya Bekshe, Nobeksha, Nimish, Udmeshanadiga, so all the flexion, extension, all these things happens, and it also influences the Samanavata, also influences the Apanavata. So we can imagine that this is something which can be connected to the whole Vata system, and over a period through that it also influences the Pitta and also Kapha. In general, this is the thing. So actually what happens is that when most of the time, especially when there is a thyroid dysfunction happen, we have two thyroid type of dysfunction. One is hyperthyroidism and hypothyroidism. In hyperthyroidism, the hormone is too much, so there is an increase of pitta and vata, and there is a reduction of kapha in the hyperthyroidism. So far the hypothyroidism is concerned, just opposite, there is an increase of kapha plus vata, and there is a huge decline of pitta. So there is an, if I want to speak about hypothyroidism, because it's most commonly seen in, there is a huge increase of kapha in the system. So people will have Guru Gatrada, Aruji, Vaksara Bhanga. So they will feel very tired, they have lethargic, they have no interest in that. It's creating a sort of Agni Mandya, decline of the Agni, and there is a Ama produced. And this Ama, which is associated with kapha, will go to Rasadhatu, and from Rasadhatu, it declines the Rasadhatu Saratva, you know, the slokas like Ashadha, Ariji, Asyavedisa, Marasatnyada, these type of things will happen. And it also extended to the whole body. So normally the symptoms will be like, especially so far hypothyroidism is concerned, it may have a fatigue, people may say there is a weakness, weight gain, constipation, cold intolerance, dry skin, hoarseness of the voice, or edema, different congestive dysfunctions, maybe depressions, muscle cramps, some paresthesias, maybe menorrhagia, like that. And if you do examine the patient, so you can see the hypothermia, some bradycardia, especially if you do examination of tendon reflexes, you can find in a chronic cases a delayed reflection. In a children, you can see the tongue a little bit protruded, very important sign to identify thyroid dysfunction in children. Hair loss, very common complaint. And often it could be very difficult to differentiate, and many times it may be confused with anemia, confused with a mild dementia, vitamin D deficiency, Lyme disease too. So there are even often if it is in woman, often it may be confused with the premenopausal symptoms too. So diagnosing this problem, treatment plan should be very clear. So we should think a few things about the diagnosis too. So keep two things are to be kept in mind instead of T3 and T4 TSH. Imagine T4 is enough to know the T4, as well as if you want to know very specifically, better to know the free T4. It's called free T4. So suppose free T4 and TSH is normal, then we consider this as a normal person. Suppose if it is a TSH is normal, but free T4 is very low, then imagine that free T4 is low, means there is some non-thyroid illness. It may be malignancy, it may be some other diseases where we can have this. And in the contrary, suppose TSH is normal, but free T4 is very high. This means that person is already taking thyroxine. Maybe it happens to non-thyroid illness also, but it may be the person is not taking the thyroxine the appropriate dosage, or the person is doing high altitude activities or very exertional activities. There are many other situations. Again, so this is TSH is normal. Then it comes to when TSH goes low, then if free T4 is low and TSH is high, very important, that is primary hypothyroidism. TSH is high and free T4 is low. And opposite, if TSH is low and free T4 is also low, then this is secondary hypothyroidism. So like that we can classify these things very easier way, which you already know, or you may be able to understand these things easily. Now let me explain you how we should treat. So when we have hyperthyroidism, the opposite things will happen. What I mean to say is that if we have hyperthyroidism, that means TSH is going very high. Also free T4 is going very high. This means that there is a primary hyperthyroidism. And the other way, if TSH is also high and free T4 is also high, then it's a secondary hyperthyroidism. So in primary, TSH will be low, but when it goes to secondary hyperthyroidism, TSH also will become high. So let us see what the symptoms are. So as I mentioned, when hyperthyroidism happens, there is an increase of pitta, strong appetite, hair loss, strong energy metabolism, complaining of weight loss. Weight loss is a classical thing of hyperthyroidism. Somebody comes in your clinic, any patient comes in a clinic, as a clinician, let me tell you, they complains that I have a drastic weight loss in last 6 months or 1 year, more than 3 to 4 kgs, without doing any severe exercise, without done any aggressive diet correction. One of the major reason may be hyperthyroidism. Second thing may be tuberculosis, not very common nowadays, still we should not exclude. Third thing, if it is an elderly person, think about malignancy. Fourth thing, which could come the second, if it is in the middle age too, I think, is the diabetes. So hyperthyroidism, diabetes, then malignancies should be kept very crucial in the mind. Don't exclude this, because don't think otherwise. So suppose patient comes with weight loss, don't underestimate that. Okay, no, it doesn't look not necessary, but it could be malignancy. But often it happens, very often it happens. It's very simple to check thyroid first, because just check the T3, T4, TSH, so you exclude this. Tuberculosis, simple sputum examination, or if it is related with a tuberculosis spine, just simple X-ray of the spine to identify the ivory vertebrae. So like that's very simple technique, we can exclude this. Because why I am telling this, because most of the time it's very difficult to identify malignancies, because it may be very complex in the presentation, maybe not even in the detectable plane. Again, diabetes is quite easy to diagnose, so you just check the HbA1c is enough. Now come to the point of management. So for hyperthyroidism is concerned, as I mentioned before, there is a huge increase of pitta, atyagni. Pitta, also vata is increased, and kapha is very, very low. So what we have to do? We have to use pitta hara kashayas. In our practice, we use drakshadi kashayam, vidadhyadi kashayam, tiktakam kashayam, like that. Or we can make some simple toya pakam. That is shadiba, chandana, ushira. There is a yogam in the Jara Chikitsa, khana chandana shundya, parpado ushira sadidam, shidam tepyo, hidam toyam, pajanam trujjarabaham. So in that, let us remove the shundi. Okay, you can have khana, that is chandana, shundi. We can remove shundi. Ambu, if it is available, we can use, but in your area, I am sure it's very difficult to get musta. So we can make a simple toya. We should have an ahara that should really reduces the atyagni. We can use kritam, like a kalyanaka kritam, very good. We can use churnas like avibhakti churna. It is sarve samasa shaudrena gudiki krita, that yogam visheshat pittarogina avibhakti churna. Mild laxative is very good because it can eliminate the pitta which is residing in the koshta, so it will help. Again, the Chira Kashaya like Trivurt, Shyama can be used. We use different treatment on the head like Talabodichil, Talam, this type of things. Normally, Snehapana is not recommended. If you are doing Snehapana, again, you may be able to do in a higher doses in Uttama Matra. We have to be very careful. Initially, we start with some kashayas, and later stages we use Chidapaka kashaya, Chida with thing. Medicines like Kushmanda Rasayana, Parushagadi Lehya, these are some of the medicines very, very good. And also, we can use some Rasaushadhas like Pravala Bhasmam. If you use Pravala Bhasmam 100 to 200 milligram twice with water could be very good. Or Kamaduga Rasa, 1 to 2 tablet B. Lagusudha Shekhar Rasa, also very good for Pitta Shamana, 1 to 2 tablet with the milk. Shanghabhasma with the water could be of another choice. So these are some of the medicines which could be very good result. Again, we can use, if it is a hyperthyroidism, the above prescription is very good. But if it is a hypothyroidism, then we have to treatment will be in the other side. The situation is there is an increase of kapha vata and there is a decline of pitta. So we have to push pitta up in hypothyroidism. So where we have to use Varanadi Kashayam, where we suppresses the reduces the kapha. So we may use Gugulu Tiktakam Kashayam, Varanadi Kashayam, these type of things. And also food should be we should be increasing the Agni. And we can use the Panchakola, Pipali Mula, Chabe Chitra Kanagara, these type of things. Again, here also mild Virajana could be good, but we may use castor oil, different type of castor oils may be effective. Again, in hypothyroidism, we very effectively use a treatment called Takrathara, a treatment with the buttermilk, with the musta, amalaki and all in the head. We can use Udvardhana very effectively, and Vamana is a very excellent treatment in a chronic hypothyroidism. If it is a chronic hypothyroidism. And Raktamokshana could be again a very good medicine of choice. We commonly use in Ayurvedic here in Kerala practices, we use Hamsabatyadi Kashayam, Punarnavadi Kashayam with Kanjanara Gugulu or Kaishora Gugulu. We use Rasa Sinduram or Annavedi Sinduram, like Swayamagni Sinduram, Shadharana Churnam. These are some of the medicines we commonly use in our practice. So then comes another disease actually called Hashimoto thyroiditis. In the thyroid, nowadays a large number of people have this autoimmune thyroiditis. As you know well that this thyroid gland get affected by its own cells, which damages the parenchymal cells of the thyroid, and it in turn it produces a destructive tendency over a period which can create a small nodular swelling in the neck. In such cases, initially we have to start with the Pitta Shamana treatment, then go to Kapha Shamana treatment, then we have to go for more Rasayana. So initial stage may be like Pravala Basmam, Abraga Basmam, Swarnamakshika Basmam, or like Kamadugarasam, like Legusudha Shegarasam. This type of things could be a first stage. But later, so this is a very Pitta Shamana. Then later stage we have to use Kasisam, Loham or Tanganam or even Surya Prabha, Gudika, this type of thing can be good. But at later stage, since it is an autoimmune, very chronic, we may use Rasayana medicines like Siddhamagaradvajam or Sudashekharasam, Mandura Vadakam, Swayamagni Sinduram, etc. That's another possibility we can do. Interestingly, even with this, all this above, there are symptoms maybe mimicking to menopause. So we have to be careful about menopause symptoms and to differentiate these, and based on the symptoms we also treat that thing. And very importantly, when we treat hypothyroidism, we have to be very careful to tackle the Kapha and Medovruti, and all the treatment should focus on Kabhahara medicines. And let me give you some examples what we do. One is an Upavasa. So Upavasa could be a very good choice, especially in hypothyroidism. And we should give a diet which is Ruksha Alpa Katu, that is very Kapahara type of food. And we may give Udvartanam, Ruksha Sweda, Vyayamam, and yoga like breathing exercise could be of very good. Different type of vastis, there are specific vastis are also mentioned. That which is having a lekhana property can be of a very good choice. If possible, it's a very important thing is to have nagara, that is ginger water every day. Or even simple everyday ginger water drinking itself have enormous effect on hypothyroidism. Or Panchakola Churna decoction could be of a great choice. Very importantly, if somebody is having hypothyroidism, there are few things has to be clearly mentioned to the patient. First thing, please avoid day sleep, because Divasopna definitely having enormous effect on hypothyroidism, because it influences the ama, it creates a Rasadhatu problem, etc. And again, milk product could be of very important to avoid milk product. Shira, Dadi, Kruda, all these things. Maybe buttermilk may be good, but preferably buttermilk should be of a properly made one. Again, Abhyanga, that oil, different oil massages. Generally, oil massages are not good to these people. And also, Snehapana is not at all good. If you want to, if you are very particular of doing Snehapana, then you may use Thaila instead of Kruda. So these are the general guidelines, and in our area, maybe it's not very common in your place, in our area, a underground stem modification called tapioca, which is well known goitrogenic. So we ask the people to stop using tapioca. Again, the cabbage, the cauliflower, there are some vegetables also found very much goitrogenic in nature. So normally we ask them to avoid such cases. If we treat the people in a proper way with Ayurvedic medicines, definitely we can bring wonderful result. If we get a fresh, that means freshly diagnosed case of hypothyroidism, if they are not started taking any L-troxin, and the TSH level even up to go to 50, which is normal is 5, still we can start with Ayurvedic medicine like Kanjanara Gugulu or Pravala Basmam or Soyam Agni Sinduram. Definitely we can bring wonderful results. The Adimadi Kridam is only one Kridam which is mentioned in the Pandu, which is one of the very good Kridam. There are many other Kridam mentioned in Pandu, Kalyanagam, other things also. They are also effective, but Adimadi Kridam is one I would like to highlight. This is very, very effective in bringing wonderful result in hypothyroidism. We have conducted many studies. If just give you an example, if somebody having a thyroid dysfunction telling TSH is 20, they say I have hair fall, I have some neck pain, I have muscle pain, like that. If they say, tell them stop taking thyroxine. No need to switch on to thyroxine. You just start giving Dadimadi Kridam, 5 grams every day morning. Monitor the patient for next 15 to 1 month. They will say, I feel better. Their metabolism will increase. They feel much better. They have a very good result. So this is one category of people. If we get freshly diagnosed, definitely we can bring good result. And secondly, there are a lot of people comes in the clinic asking about can we withdraw that is thyroid hormone tablets and switch on to Ayurveda. Yes, it is also possible. We can switch on to Ayurvedic medicine. If they are taking 50, 12.5 or 25, maybe you are able to stop immediately and switch on to Ayurveda. But suppose they are already taking 50 plus, that means 75 mg or 100 mcg. Better not to stop suddenly. Rather, you switch on to Ayurvedic medicine slowly, then you taper down the other doses, which is safer. So, I personally done a large number of cases with thyroid dysfunction and found able to withdraw, even at 100 mg cases, we can withdraw between 6 to 8 months. Maybe it may go to 1 year. So, what I want to highlight at this point is that hypothyroidism, especially thyroid disorders, are really pragmatically, it could be able to manage very, very successfully with Ayurvedic practices. There are very good products available and we can use those medicines. Even if you have a simple logic that the dosha combination, that is more than enough, you can get wonderful result. I think by these words I will stop, and thank you very much for hearing me at this moment. If you have some questions at this moment, they can type in the bottom so that I can answer.